Namaste and welcome to Aastha Ayurveda. Today we are going to share with you some information on the treatment and prevention and management of migraine. See, migraine is a very common problem. Most of the people you find in day-to-day life, you meet people day-to-day life, they suffer from the migraine. The main symptom is headache. Migraine is described as Ardhavabhedak in Ayurveda. Ardhavabhedak means half-sided headache, which is very recurrent, and this is the main symptom of migraine headache. Headache has so many other reasons as well, but to diagnose migraine, it's very important to take a proper history of the patient who suffers from migraine. In practice, we see that females suffer 3 times more than males of this migraine headache problems, and their predominating symptom is headache, which may or may not be half-sided. So some people have full headache, some people have half-sided headache, but the main symptom is that this headache is always recurrent. It comes in cycles. Some people get headache every third day, some people have headache every seventh day, some may have once in a month as well. And the severity also is variable. Some people find it very difficult to control without taking the very strong analgesics, while some people can tolerate it and they feel very good relief when they fall asleep or when they vomit out the toxins of the body. So in most of the cases we find a family history. It often runs in the families. So any female suffering from migraine, you will find a family history, like her sister or her mother may give you a history of the same illness. So whenever we find a person with a half-sided or full headache which is recurrent and which is accompanied by the nausea or vomiting sensations, we always try to diagnose it in terms of migraine. So far, many things like diagnosing one's eyesight, taking care of other conditions like cervical spondylitis, and also advising some investigations like MRI scans is very beneficial to diagnose it correctly. If the diagnosis is very clear, then we can proceed next to the prevention and the management of this problem. So whenever a person is in acute pain, acute headache, then you will need expert's advice. But to prevent it, or to make the severity very less, or to make the cycle very long that a person suffered from it, you can follow the Ayurveda. Some of the techniques in Ayurveda, like Nasya therapy, or putting some medicated oils in the nose of a person who suffers from the disease continuously, is very beneficial in preventing this kind of headache. Even when the person is having the headache, we give specific other medicines in form of the oil and whether as some powders to relieve the headache. But one can also put oils, and specifically anu telam. You can procure this anu telam from any good reputed company, and you can instill 3 to 4 drops in each nostril every day in the early hours of the day. So this gives relief, this gives prevention to the headache in long term. Secondly, we ask the person to consume alkaline diet, like include salads in your diet and avoid the sour things, sour fruits, the fermented things, bread, sauce, vinegar, mayonnaise. These kind of things should be avoided. Junk food, excess of sugar, chocolates, tea, coffee, cold drinks, they should be avoided. Second part of the migraine treatment is taking care of a good sleep. Most of the people who have very sound sleep don't get this problem frequently. So if you ensure that a person gets good sleep, and you can advise the person some good head massage with the oils, you can also go through the Shirodhara therapy, You can practice the breathing exercise, pranayama, or some meditation technique, or any relaxation techniques to uh, prevent the headache. In practice, we find this meditation techniques, breathing exercises, helping the person to get very sound sleep, and the nasya therapy. These are very basic things which every doctor, I hope, in Ayurveda advise his or her patients to follow to prevent the problem. But once the person has an episode of the migraine headache, then it's very important to ask the person to go to the expert and go through the nasya therapy with some more strong medicines and some more oral medicines, some tablets or the liquids which are beneficial for the treatment of the